Have you ever felt an unusual sensation on your skin that left you wondering if it was trying to tell you something important? As we age, our bodies communicate with us through subtle signals, tingles, burns, and strange sensations that most people ignore or dismiss. But here's what doctors won't always tell you. Where and how your skin feels could be revealing critical information about your health that might add years to your life if you pay attention now. In fact, research has shown that certain specific skin sensations in older adults directly connect to serious underlying conditions that could be silently shortening your lifespan right this moment. That's right. What feels like a simple discomfort might actually be your body's desperate attempt to warn you about something far more serious happening beneath the surface. In this video, we're exposing 4 specific skin sensations that medical experts have linked to potentially life-threatening health problems in seniors. These aren't random symptoms. They're documented warning signals identified by specialists who study aging and longevity. Each sensation reveals something crucial about your circulation, organs, nervous system, and metabolic health that you absolutely need to know. By the time we finish today, you'll know exactly which sensations deserve immediate attention and what simple steps you can take to potentially add healthy years to your life. So please watch until the end, because understanding these signals could mean the difference between vibrant independence and serious health decline in your golden years. If you haven't subscribed yet, now's the perfect time to hit that button and turn on notifications so you never miss life-saving information like this. Let's begin. Number 1, burning sensations in the hands and feet. One of the most commonly overlooked but revealing signs that something serious may be happening inside your body is a persistent burning sensation in your hands and feet. Many people write this off as simple circulation issues or normal aging. But when this feeling occurs regularly without obvious cause, medical experts consider it a red flag that demands attention. Research has shown that older adults who experience frequent burning in their extremities may be suffering from peripheral neuropathy, damage to the nerves that carry messages between your brain and limbs. This nerve damage doesn't just cause discomfort, it signals potentially dangerous conditions developing in your body. Consider Margaret and Elizabeth, both 73 years old. Margaret stays active, monitors her health regularly, and rarely experiences unusual sensations. Elizabeth, however, has noticed increasing burning feelings in her feet, especially at night. She's tried different shoes, creams, and even soaking her feet, but nothing helps. What Elizabeth doesn't realize is that this burning sensation could be her body's alarm system warning her about undiagnosed diabetes, serious vitamin deficiencies, or even toxic medication effects. When peripheral nerves become damaged, it doesn't just create discomfort. It represents a breakdown in your body's communication system. This type of nerve damage has been directly linked to diabetes, vitamin B12 deficiency, autoimmune disorders, and certain cancers. Even more concerning, it often appears years before more obvious symptoms develop. The burning sensation occurs because damaged nerves send incorrect signals to your brain, creating phantom pain or burning where no actual heat exists. As this progresses, it can lead to numbness, weakness, and eventually significant mobility problems that dramatically increase fall risk. One of the leading causes of death in seniors over 65. The encouraging news is that nerve damage can often be halted or even reversed if caught early. Simple blood tests can identify many underlying causes, while nutrition changes focusing on B vitamins, regular gentle movement, and medication adjustments can protect your nerves from further deterioration. If you've been experiencing persistent burning in your hands or feet, especially if it's worse at night or affects your balance, don't dismiss it as just getting older. This sensation could be your early warning system identifying serious health issues while there's still time to address them effectively. Number 2, prickling sensations across the upper back. A prickling or pins and needles feeling across your upper back might seem like a minor annoyance, but medical experts now recognize it as a potential warning sign that demands serious attention. Many seniors experience this sensation between their shoulder blades or across the upper back region, and mistakenly blame it on muscle tension or skin irritation when something far more concerning may be occurring. Recent medical research has revealed that one of the most overlooked causes of upper back skin discomfort is cardiovascular dysfunction. Specifically, early signs of heart failure or serious circulatory problems affecting the thoracic region. These systems responsible for keeping your body oxygenated and nourished often send their first distress signals through nerve pathways connected to the skin on your upper back. Take Thomas and Robert, both 78. Thomas maintains regular heart checkups, stays physically active, and reports feeling good most days. Robert, however, has been experiencing increasing prickling sensations across his upper back, especially after mild exertion or when lying flat at night. He's tried massage, new pillows, and topical treatments, but the sensation persists. What Robert doesn't understand is that this seemingly minor discomfort could be his body signaling that his heart isn't pumping efficiently or that blood vessels supplying his upper body are narrowing. When your cardiovascular system struggles even slightly, the reduced blood flow and oxygen delivery can irritate nerves serving the upper back, creating this distinctive prickling sensation. The danger here isn't the discomfort itself, it's what it represents. Cardiovascular disease remains the leading cause of death worldwide, and especially in seniors. What makes these early warning signs particularly valuable is they often appear months or even years before more obvious symptoms, like chest pain or shortness of breath, develop. These skin sensations typically follow patterns. They might worsen with exertion, certain positions, or during specific times of day. They often feel different from typical muscle pain, with a distinctive quality that's difficult to ignore once you become aware of it. The positive news is that many heart conditions respond remarkably well to early intervention. Simple modifications like improved posture, specific heart-healthy exercises, dietary adjustments, and appropriate medications can significantly improve cardiovascular function when problems are caught in these early stages. If you've been experiencing unusual prickling across your upper back that doesn't respond to normal treatments, pay close attention to when it occurs and what makes it better or worse. This information could provide critical insights for healthcare providers evaluating your heart health. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. Number 3, crawling sensations on arms or shoulders. When older adults experience strange crawling or creeping sensations on their arms or shoulders, most quickly dismiss them as nothing more than senior moments or aging skin. But neurologists and aging specialists have identified these peculiar feelings as potential early warning signs of neurological changes that could impact cognitive health and even predict certain types of dementia. The sophisticated nerve pathways connecting your arms and shoulders to your brain serve as sensitive indicators of neurological health. When these pathways begin detecting unusual sensations without external cause, it often signals early changes in how your brain processes sensory information, potentially revealing important information about your future cognitive health. Consider Catherine and David, both 82. Catherine maintains regular mental stimulation through reading and social engagement, sleeps reasonably well, and rarely notices unusual sensations. David, however, has become increasingly isolated, experiences fragmented sleep, and has recently started feeling strange crawling sensations on his arms and shoulders, particularly when trying to relax. He's checked for insects, changed detergents, and even bathing routines, but the sensations persist. What David hasn't realized is that these feelings might be early indicators of microvascular changes in his brain, tiny alterations in blood flow to specific brain regions that control sensory processing. These changes often precede more obvious cognitive symptoms by years, providing a potential window for intervention before significant damage occurs. Research has shown these types of sensory disturbances correlate with increased risk of cognitive decline and certain types of dementia, particularly those involving vascular components. They represent not just momentary discomfort, but potentially valuable information about brain health that should never be ignored. These sensations typically have certain characteristics. They often appear during quiet moments when other distractions fade, may worsen with fatigue or stress, and have a distinctive quality different from typical skin irritation or muscle discomfort. Many patients describe them as insects crawling or electricity moving beneath the skin. The encouraging news is that many factors affecting brain microcirculation are highly responsive to lifestyle interventions, especially when addressed early. Regular cognitive stimulation, social engagement, physical activity that gently elevates heart rate, and improves sleep quality can all contribute to better neurological function and potentially reduce these troubling sensations. When David began a regular walking routine, established consistent sleep patterns, and reconnected with old friends through weekly gatherings, he gradually noticed the crawling sensations diminishing. The improvement wasn't immediate, but as his overall neurological health improved, so did the uncomfortable feelings. If you've been experiencing unexplained crawling or creeping sensations on your arms or shoulders, consider them potential signals from your nervous system about brain health that deserve professional evaluation, especially if they're persistent or increasing in frequency. Number 4, tight or constricting sensations around the neck or throat. An often overlooked but potentially critical health warning appears as unusual tightness or constriction around the neck or throat area. While most people immediately worry about heart concerns when experiencing chest discomfort, few recognize that sensations in the neck region might be revealing crucial information about endocrine health, particularly thyroid function, that could significantly impact both quality and length of life. Medical research has shown that older adults who report persistent tightness, pressure, or strange sensations around the neck area, even without visible swelling, may be experiencing early warning signs of thyroid dysfunction, a condition that becomes increasingly common after 60 and affects virtually every cell and system in the body. Consider Barbara and Helen, both 71. Barbara maintains regular health screenings, consumes adequate iodine through diet, and manages stress effectively. Helen, however, has developed a progressive feeling of tightness or pressure around her neck and throat. Sometimes it feels like slight constriction, other times just strange awareness. She's tried different collars, scarves, and even throat lozenges thinking it might be minor irritation, but the sensation continues. What Helen doesn't recognize is that this persistent feeling might be her body signaling changes in her thyroid gland, the master controller of metabolism that regulates everything from energy and body temperature to heart rate and cognitive function. When the thyroid begins to malfunction, either producing too many or too few hormones, the gland itself often changes in size and texture, creating sensations that might not be visible but are certainly felt. The danger with thyroid dysfunction lies in its systemic effects. Untreated thyroid problems can lead to serious cardiovascular complications, bone loss, severe depression, cognitive decline, and extreme fatigue, all factors significantly impacting longevity and independence in seniors. These neck sensations often have distinctive patterns. They might fluctuate throughout the day, worsen during stress or fatigue, and create awareness of the neck area that feels different from muscle tension or skin irritation. Many patients describe it as feeling like something is there or pressure from within that doesn't relate to external factors. The good news is that thyroid conditions rank among the most treatable endocrine disorders when properly identified. Simple blood tests can detect imbalances, and treatments ranging from medication to dietary adjustments can effectively restore proper function in most cases. Additionally, certain nutritional approaches focusing on selenium, zinc, and iodine can support thyroid health when implemented appropriately. If you've been experiencing unusual sensations around your neck or throat without obvious external cause, particularly if accompanied by changes in energy, weight, temperature tolerance, or mood, these feelings deserve professional evaluation. This small butterfly-shaped gland has enormous influence over healthy aging and longevity. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Final thoughts. Now that you've learned about these 4 specific skin sensations that could signal serious health concerns, Take a moment to honestly reflect. Have you experienced any of these warning signs recently? A burning sensation, a prickling feeling, strange crawling, or unusual tightness might seem trivial in isolation. But as we've discovered, each could reveal critical information about your internal health that might literally save your life. From nerve damage signaled by burning extremities to cardiovascular issues manifesting as prickling across the back, from neurological changes revealing themselves through crawling sensations to thyroid dysfunction, creating feelings of constriction. Your skin serves as a sophisticated early warning system connected to every major system in your body. The most empowering aspect of this knowledge is that identifying these sensations early provides opportunity, not cause for fear. Each warning sign offers a window to investigate and address potential issues before they progress to more dangerous stages. This proactive approach to health can make all the difference in maintaining independence and vitality as you age. Simple adjustments can make profound differences. Gentle daily movement improves circulation and nerve health. Specific nutrients support brain and thyroid function. Stress management techniques reduce systemic inflammation. And most importantly, sharing these sensations with healthcare providers ensures proper evaluation and targeted treatment when needed. If any of these sensations sounded familiar, consider it valuable information guiding you toward better health. Start with one small change addressing that specific concern today. And if none of these signs currently affect you, you're now equipped with knowledge that might help you or someone you care about recognize these warning signals immediately if they appear. Because ultimately, our goal isn't just extending life, it's ensuring those additional years are lived with vitality, dignity, and purpose. Understanding and responding to your body's early signals, particularly these unusual skin sensations, is one of the most powerful ways to protect your health and independence for years to come. Thank you for joining us today. We'd love to hear from you. Leave a comment sharing one insight you gained from this video and how you plan to use this information. Your thoughts matter tremendously to us, and your engagement helps shape our future content. If you found value in today's discussion, please like, subscribe, and share with someone who might benefit. Your support makes it possible for us to continue providing information that could truly make a difference. Thanks for watching, and we look forward to connecting with you in our next discussion.